One of the most common questions that I get asked on a day-to-day basis is how should I study? And I consider myself one of the foremost experts on studying because not only did I make it through pre-med, through medical school with flying colors, got over 90th percentile on all of my exams, but I did that while balancing companies, while taking care of a puppy, while playing professional beach volleyball as a pre-med. So I had to find a way to make studying work for me better than it did for other people because I had less time to do it, so I wanted to do it more effectively. So I'm gonna be teaching you a lot of different strategies that I used to get more in less.
Let me ask you, what really makes a good doctor? If you're not happy, how are you supposed to help your patients?
So the first thing that I want to preach to you guys, and this is going to come as a big shocker, but please don't cram. Cramming for your exams causes all kinds of problems. The first one is that your recall plummets if you try and cram all the information in right before your test. If you know that you have a test coming, you should already be studying for that exam well in advance. You should be reading every single day. You should be doing questions every single day. However, I know that sometimes this is just not possible to be prepared for a test way in advance. I know in medical school, sometimes we had 3 exams in one day, 5 or 6 in a week, and these were all really challenging exams. So you had no choice but to cram. The next thing I want to talk to you about, and this is probably the single most asked question related to studying, is what resources should I use? So my big takeaway that I want you to get from this is that this is going to depend a lot on the person, but my personal preference and what I tell everybody is use standardized resources. Use resources that are available online that everybody is using. A lot of schools and programs are going to throw PowerPoints and lectures and videos all at you, and you're supposed to study that in addition to the standardized sources, which are literally the gold standard for preparing for that exam. And you could get overwhelmed with too many resources trying to get through school lectures and standardized resources. I would say pick the standardized resource, double down on that, spend extra time hammering that in, and even if your class grade suffers a little bit because of it, your grade on that standardized exam is going to be better because you spent more time on those standardized resources, whereas everybody else is sifting through a million things that probably aren't relevant. They're double studying, they're wasting their time. Another important subject I want to talk to you about is sleep. I value sleep very much. I only get 6 hours a night, but I make sure that those 6 hours are quality. There's a lot of studies that have been done regarding sleep and how it affects academic performance and association with GPA. Overall, sleep deprivation is bad for your GPA, bad for your academic performance. However, if you do need to choose between studying and sleep before an exam, and you are a young, healthy undergraduate or graduate age student, studying is more important. Studies have shown, recent studies, that in a healthy undergraduate aged person, cognitive ability does not decline in acute sleep deprivation. That's one night of sleep won't hurt your mental performance that much. However, it does affect your physical performance, but we're not talking about that right now. The next super important thing that I want to talk to you about, and this applies to a lot of areas of life, but this guy right here, get it out of your study room. There's just the fact that I know this is here and that it's on vibrate and that someone could contact me at any moment is a distraction. You need to remove that distraction from your study environment. Put it on silent or turn it off. Put it in a bag, put it in another room. Get it out of your sight, get it out of your mind. If you know that it's there, your boyfriend or girlfriend might be texting you or calling you or somebody that you like, your mind is not going to be on where it needs to be, which is this. Not this book specifically, but on the studying. Get your phone out of there, silence it. You do this when you sleep too, super important. So another thing a lot of people ask me is, do I listen to music when I study? There's gonna be a lot of mixed reviews on this. I do. I listen to very long compilations of music on YouTube. An hour, 2 hours. Sometimes it's like an active playlist where they're constantly running different things. I do not listen to music with words in it. I listen to instrumentals, I listen to Bach, Beethoven, things that I think actually stimulate my mind to continue thinking, to continue focusing. They actually help me focus. However, if you're listening to music with words, I think that can be very distracting. I think you should not do that. Location, location, location. This doesn't just apply to business, this applies to studying. Do not study in your bed, and pick a location that you're going to study at consistently. I think too much change of environment, especially if you're changing active environments like coffee shop to library to other thing, that can be very distracting. I think you should get comfortable with the place. I think you should study there as much as you can, and you should be studying at a desk with a chair. Do not study in your bed. You want to study in a position that you're actually going to be recalling the information, which is when you're taking your test. So a lot of people ask me, should I study in groups or should I study alone? This is really going to be depending on you. I know a group who studied together every day at my medical school school and they all scored top of my class. So here is what I deduced from that. It's like playing sports. If you play with people who are better than you, you're gonna play up to their level. You're gonna get better, you're gonna study better. However, if you're studying with people who are not as good at you as you, you're gonna play down to their level. You're not gonna study as hard, you're gonna have less expectations of yourself. So I think if you're gonna find a study group, find people who are better than you, who are gonna push you to study harder than you ever thought you could. Adderall and stimulants. I am very aware that a lot of people in the undergraduate and graduate years are using these drugs to help them with studying and help them with academic performance. I really highly suggest against this. This is a drug that is non-medical use for studying. Unless you have ADHD, you have no business taking this medication, and it's going to create dependence. There's new research suggesting that it's going to be associated with early dementia. And again, if you have trouble with mental fatigue or concentrating, you should really try something like meditation or one of the hacks that I'm going to talk about in a minute. So the next thing I want to talk to you about before my hacks is going to be studier's guilt. Now, studier's guilt is something that we all feel. I felt it, my friends feel it, and so do you. It just happens, it comes with high pressure academic institutions. It is that feeling that when you're not studying, everybody else is, and that you feel guilty because you should be studying too. And this is going to hurt you because you should actually be going out and spending some time in nature every day. You should be going to the gym and exercising every day. You should be taking 30-minute breaks during your long study sessions to just stretch, take a deep breath, and I meditate for 10 minutes every hour or so. It just keeps my brain feeling clear, feeling good. Conquer the studier's guilt, acknowledge that it's there, acknowledge it for what it is, and then go beat it. Now I'm gonna give you some of my super secret study hacks that I actually haven't shared before, and maybe I'll make a follow-up video about it at some point. So the first one, and I learned this from memory guru Jim Quick, and he's actually awesome. If you wanna check out his stuff on YouTube, he's great. The secret is that when you're studying, retention is associated with emotion. That's why when you're younger and you're happy and you're learning things, you actually have a much higher retention time. However, when you're older and you're studying and you're miserable, your chances of remembering what you just read are that much lower. So a trick to change your mood instantly: smile and stand up and do some short exercise, and I guarantee you sit back down in a better mood. Smile while you read, and I guarantee get excited about what you're reading. You're much more likely to retain that information. The other trick for retaining information, instead of reading the page a zillion times like everyone else, which is just not efficient, is after you're done reading a page or reading a pretty hard fact that you really want to stick in your head, take a moment, and you don't have to write it down because it's going to take you forever, but come up with a question, a real life question. For example, when I'm studying for my step 3 boards and I'm learning about, say, endocarditis, and I read a question about who's more likely to get this type of endocarditis, I actually imagine a patient coming in with a certain presentation and the workup and what is going to go into diagnosing that patient, and I guarantee if I get a question on it, because I already came up with the question in my head and knew the answer and answered it for myself, I'm going to remember that answer. So do that for as many questions as you can, as many points as you can, and I guarantee your retention rate is going to be higher. Use mnemonics. They're my favorite thing in the world, and now you guys are lucky enough to have things like Sketchy Micro, Sketchy Farm. Pixarize is a great new one that's out there. I'm actually narrating on some of their videos. When I was studying, I used to make my own. For example, von Hippel-Lindau disease. It's a whole compilation of syndromes that all go into one. And you have to remember all of those things and what they're associated with. And in order to do that, I drew a hippo with some features on it, and I coordinated them to each individual sequelae of the disease. You don't have to do all of your own. A lot of them have been pre-done for you, which you're very lucky about. But I do recommend doing some of them on your own, because there's no way you're more likely to remember anything else than your own good mnemonics. And the last one, so my last hack for you, and that is a caffeine hack. Everyone drinks coffee. We depend on it during studying. It keeps our brains awake, alert, and it's actually a nootropic. It helps us focus. However, a lot of people are sensitive to coffee, or they're desensitized to coffee. Coffee is in and out of your system pretty quickly. I think the half-life is about 4 hours, but we'd be lucky if we get even half of that before we need another cup. A little hack around this is either take your coffee or your caffeine pills with L-theanine. It's an amino acid that's found in a lot of teas, a lot of very common teas, and it's actually a nootropic on its own, but all of that jittery feeling that you get when you drink coffee or you take caffeine pills, the stimulant effect that's really not helping you study but is helping you concentrate, it amplifies that, and it really just helps you prolong your caffeine, makes you need less, makes you study better with it. It is honestly a lifesaver, and there's a lot of good emerging research on it. I encourage you to do some of that on your own, but just a little hack, something to try. If it works, great. If it doesn't, it won't hurt you. That is the end of my study tips. I hope you enjoyed them. If you like this video, please share it with your friends. Share my study tips with them. Don't hog them all for yourselves. And if you did like this video, please subscribe to my channel as well. I'll be doing a lot of other stuff just like this for you, and I appreciate all of your support. There's a lot of related videos in the corners that you can check out. And again, thank you so much for watching. I'll see you at the next time.
Thank you for watching this video. If you liked what you saw and you want to see the next one, be sure to hit subscribe. The button is either there, or there, or there, or there. And the next video should also be posted on this end screen as well. On behalf of me and my dog, until next time, guys.